I just want to take a minute to talk about blood pressure, heart disease, cholesterol, that kind of stuff. There's a lot of confusion lately on, what's the ideal cholesterol level, what's the ideal blood pressure, and that kind of thing. I do feel like the cholesterol medicines are kind of overly treated, overly emphasized in medicine. That some of that could be a pharmaceutical push. A lot of the newer studies show that LDL cholesterol isn't as important as it once we thought was. In my opinion, I'll kind of go through kind of my way of thinking when it comes to that kind of thing. Now, as far as blood pressure goes, the newer studies are kind of pushing that number back further and further and further, like closer to the 120/80 or less, where before, when I first got out of school, you didn't really treat blood pressure unless it was under 140/90. I'm a real big believer in treating blood pressure and maintaining blood sugar levels. And I'll explain to you why. Now, let's just say this is one of your blood vessels, right? When we think about blood pressure, that's just pressure that we're basically putting on the vessel. Let's just say this is an artery, right? So you can think about a water hose, just pressure under it. The more pressure you have under that system, whether it's a blood vessel or even a water hose, right, you're going to cause more damage to that area. Now, think about blood sugar, and at least in my mind, how I think about blood sugar. Blood sugar can be very caustic, right? It can cause damage to vessels. So if you got high blood pressure and you've got high blood sugars, think about the damage that's being caused to that area of that artery. Now, if you don't have high blood pressure, you don't have high blood sugar, then cholesterol is not such a big deal. But if you start getting multiple risk factors, high blood pressure, high cholesterol, that's where you start becoming problems. So think about it this way. Say I've got an injured area, whether it's due to blood pressure, due to high blood sugars, to inside of this artery here. What happens? Well, we've got things called platelets that help with clotting our blood factors that are swimming through your bloodstream, right? We got white blood cells that are swimming through your bloodstream, and they're all passing this area. Well, when you have an injured area, white blood cells and platelets are going to be the first to kind of stop, right? Because they sense that there's an injury there and it wants to repair it. So white blood cells stop here, platelets stop here, and what else is swimming through the blood? Well, that's where cholesterol comes into effect. Cholesterol kind of can get trapped up in this area there, right? And when those white blood cells die, they leave us behind what's called fatty streaks, right? So with that, you get cholesterol in there. Now you can see where you can start backing up the road there, start backing up that artery, and that's where you get plaque buildup. So as far as treating cholesterol, I would say I'm not an over-treater of that, unless you've got other risk factors, high blood pressure, like I said, high blood sugars, you're obese, maybe you're older, maybe you got family history of heart disease, maybe I'm a little more aggressive. But I usually tend to err on the side of being a little more conservative with the cholesterol side. So instead of starting you out with a statin, which can have some nasty adverse effects, not to say I don't use them, but they can have some nasty adverse effects, I typically start you with a medicine called Zetamide or Zetia. It's usually a milder medicine that's usually very benign, has very little adverse effects. But let's just start with that easier medicine, see where it gets you, and if we have to add the stronger ones on, I'll do that. And then the blood pressure, like I said, I'm getting more and more aggressive when it comes to treating that. I like to see that less than 120/80. I don't want to put people in medicine unless you have to, but you just got to keep in mind that blood pressure in itself is usually due to genetic. 90% of blood pressure, like I'm a good example, I have to take blood pressure medicine. Doesn't matter how well I eat, how much I work out, that's genetic in nature. So certain things you do have to be put on medicine for. But maintaining good blood pressure, maintaining good blood sugars is very, very important. And as far as the cholesterol, you just kind of factor in, whether you're more at risk for heart disease or not. If the other risk factors are under control, then it may not be needed.